MedTerm presents a lecture on psychological trauma. Topic from the examination point of view. This lecture is made from Handbook of Behavioral Sciences Definition of Trauma. It is a type of damage to the mind that occurs as a result of a severely distressing event. Trauma is often the result of an overwhelming amount of stress that exceeds one's ability to cope or integrate the emotions involved with that experience. The types of trauma. There are two types of classical trauma. 1. Caused by life-threatening events, e.g. war, accidents, rape, natural catastrophes. 2. Caused by loss of a person, e.g. early death of parents, loss of children, adoption. Trauma. Trauma as direct personal experience of an event that involves actual or threatened death or serious injury. Threat to one's physical integrity, witnessing an event that involves the above experience, learning about unexpected or violent death, serious harm, or threat of death, or injury experienced by a family member or close associate that leave long-term negative consequences on person's mind that cannot be shaken for weeks, months, in some cases for years. However, trauma differs between individuals, according to their subjective experiences. People will react to similar events differently. In other words, we can say that not all people who experience a potentially traumatic event will actually become psychologically traumatized. Signs and symptoms of psychological trauma. People who go through these types of extremely traumatic experiences often have certain symptoms and problems afterward. The severity of these symptoms depends on the person, the type of trauma involved, and the emotional support they receive from others. Reactions to and symptoms of trauma can be wide and varied, and differ in severity from person to person. A traumatized individual may experience one or several of them. The triggers. After a traumatic experience, a person may re-experience the trauma mentally and physical, also called triggers. Re-experiencing symptoms are a sign that the body and mind are actively struggling to cope with the traumatic experience. It can damage people's sense of safety, self-efficacy, as well as the ability to regulate emotions and navigate relationships. They can range from distracting to complete dissociation or loss of awareness of the current context. And panic disorder. Triggers and cues act as reminders of the trauma, and can cause anxiety and panic attacks, other associated emotions. In many cases, this may lead a person suffering from traumatic disorders to engage in disruptive or self-destructive coping mechanisms, often without being fully aware of the nature or cause of it. Intense feelings of anger may frequently surface, sometimes in inappropriate or unexpected situations, as danger may always seem to be present, as much as it is actually present and experienced from past events. Anger affects persons' personal as well as social life. Flashbacks. Upsetting memories such as images, thoughts, or flashbacks may haunt the person. Person relives the experience again and again in the form of flashbacks that disturb his psychological condition further. Nightmares may be frequent. It can be so traumatizing that a person may become afraid to even sleep. Insomnia is lurking fears and insecurity keep the person vigilant and on the lookout for danger, both day and night. Trauma doesn't only cause changes in one's daily functions but could also lead to morphological changes. Person is unable to perform his daily task normally. He is tired and fatigued due to constant awakefulness. He becomes irritable and have mood changes if last long. Persons start hallucinating and become delirious. The person may not remember what actually happened, while emotions experienced during the trauma may be re-experienced without the person understanding why. Repressed memory. This can lead to the traumatic events being constantly experienced as if they were happening in the present, preventing the subject from gaining perspective on the experience. This can produce a pattern of prolonged periods of acute arousal punctuated by periods of physical and mental exhaustion. Detachment and dissociation. In time, emotional exhaustion may set in, leading to distraction, and clear thinking may be difficult or impossible. Emotional detachment, as well as dissociation or numbing out, can frequently occur. The person may seem emotionally flat, preoccupied, distant, or cold. Dissociation includes depersonalization disorder, dissociative amnesia, dissociative fugue, dissociative identity disorder. Depression. People may feel permanently damaged when trauma symptoms do not go away and they do not believe their situation will improve. This can lead to feelings of despair, transient paranoid ideation, loss of self-esteem, profound emptiness, suicidality, and frequently depression. Psychological trauma. The experience and outcomes of psychological trauma can be assessed in a number of ways. Within the context of a clinical interview, the risk for imminent danger to the self or others is important to address but is not the focus of assessment. In these situations, it is best to provide a supportive, caring environment and communicate to the individual that no matter the circumstance, they will be taken seriously and not just as a sick, delusional individual. During assessment, individuals may exhibit activation responses in which reminders of the traumatic event trigger sudden feelings, e.g., distress, anxiety, anger, memories, or thoughts relating to the event. It is necessary to determine how the event can be discussed in such a way that will not re-traumatize the individual. Further, it is important to note the presence of possible avoidance responses. Psychological testing might include the use of generic tests. Children are assessed through activities and therapeutic relationship. Some of the activities are play genogram, sand worlds, coloring feelings, self and kinetic family drawing, symbol work, dramatic puppet play, storytelling, Breer's TSCC, etc. To treat it. Treatment includes a number of psychotherapy approaches have been designed with the treatment of trauma in mind, like EMDR, progressive counting, PC, somatic experiencing, biofeedback, internal family systems therapy, and sensorimotor psychotherapy. There is a large body of empirical support for the use of cognitive behavioral therapy for the treatment of trauma-related symptoms, including post-traumatic stress disorder. Trauma therapy is used worldwide for treatment of PTSD. Support of family is also very important in treatment of patients suffering from trauma. Multiple choice questions. 1. What is PTSD? A post-traumatic stress disorder caused by an overwhelming stress outside the range of normal human activities for 1 week. B. Post-traumatic stress disorder caused by woman menstrual cycle outside the range of ordinary human experience. C. Post-traumatic stress disorder caused by an overwhelming traumatic event outside the range of ordinary human experience and lasting more than 1 month. D. Post-traumatic stress disorder caused by men who just got fired outside the range of ordinary human experience. E. Post-traumatic stress disorder caused by everyone's stress outside the range of ordinary human experience. Answer is C. The next Q is which of these statements is true regarding acute stress reaction disorder and post-traumatic stress disorder (PTSD). Both disorders can occur at any time following a traumatic event. B. Acute stress disorder occurs only in children, while PTSD can occur at any age. C. PTSD is not diagnosed until after 4 weeks following the traumatic event. D. Acute stress disorder describes symptoms in someone who was not present at an incident, while PTSD takes place only in those who were present. Answer is C. Which of the following is not required for a diagnosis of PTSD? A re-experiencing of the traumatic event. B. Emotional numbing and detachment. C. Hypervigilance and chronic arousal. D. Persistent and uncontrollable worry. Answer is D. Next. Which of the following statements is true about treatment for PTSD? But some clients are helped most by being exposed to memories of the trauma, whereas others are helped by avoiding memories or thoughts about the trauma. B. Repeated exposure to one's memories of the trauma significantly reduces PTSD symptoms, but does not protect against relapse. C. To be effective, treatment for PTSD should focus on the trauma rather than the client's other problems, such as marital problems. D. Systematic desensitization is effective for phobias but not PTSD. Answer is A. Next question is: PTSD have damage to the hypothalamus? B. Frontal lobes. C. Hippocampus. D. Adrenal cortex. Answer: CMCQ. Not a diagnostic criterion for PTSD. But 3 or more dissociative symptoms. B. Re-experiencing the event. C. Emotional numbing and detachment. D. Exaggerated startle response. Correct answer is A. We have a few important questions for UHS exam. 1. Define psychological trauma. Give its type. 2. What is psychological trauma? What are signs and symptoms of psychological trauma? 3. How psychological trauma is diagnosed, assessed. 4. What is treatment for psychological trauma? 5. What are effects of psychological trauma on person's life? Scenarios that can come in exams are: a case was brought in psychiatric ward of a military man. Arham saw a good deal of active combat during his time in the military. Some incidents in particular had never left his mind, like the horrifying sight of Mustafa, a close comrade and friend, being blown up by a landmine. Even when he returned to civilian life, these images haunted him. Scenes from battle would run repeatedly through his mind and disrupt his focus on work. Filing up at the gas station, for example, the smell of diesel immediately rekindled certain horrific memories. At other times, he had difficulty remembering the past, as if some events were too painful to allow back in his mind. He found himself avoiding socializing with old military buddies, as this would inevitably trigger a new round of memories. His parents complained that he was always pent up and irritable, as if he were on guard, and Arham noticed that at night he had difficulty relaxing and falling asleep. When he heard loud noises, such as a truck backfiring, he literally jumped, as if he were readying himself for combat. He began to drink heavily to forget the event. What is your diagnosis? Which psychological disorder is he suffering from? Sarah was a 35-year-old married mother of 2 children. She worked full-time, and as part of her job she drove extensively all over the Pakistan. On average she would drive 1,500 miles a week in her company car. In June last year she had a road traffic accident. Since the accident she was too afraid to drive, was very anxious, had frequent nightmares when she traveled as a passenger, and was on sick leave from her employers. After 6 months she sought help. What psychological condition is she suffering from? Scenario can be a case of a 13 years old patient was brought in psychiatry ward after being witness to a profound traumatizing event while passing a street on her way to home from school. The adolescent girl witnessed a violent aggression on a man who suffered severe mutilating injuries, being stabbed with a knife in the eye causing complete loss of vision, being cut with a chainsaw and threatened with death by gunshot. During the traumatic incident she tried desperately to call someone for help but was not able to do so. Her first admittance in the psychiatric service has been recorded 4 months following the traumatic event, manifesting anxiety, a certain predisposition to depression, and disturbed unrestful sleep. I see that man dead in my sleep. Even insomnia, somniloquy including verbalized trauma-related content, frequent weeping, aggressive behavior, a tendency towards lesser communication, loss of interest for current activities along with diminished appetite was observed. What condition do you think that girl is suffering from? Made from Handbook of Behavioral Sciences. Thank you. Subscribe for more videos and updates. Stay tuned and have a nice day.